Hi, everyone. Thanks so much for joining us. Always lovely to have you here. If you're a new listener, thrilled to have you for the first time. If you're returning, I'm thrilled to have you back. Today, we are going to be talking about a product that will hopefully be helpful for you or your staff or your community for efficiency, for documentation, for getting it right, for our anxiety around what might happen if we're audited. So let's dig in today and see what we can answer for you. Today's guest is Maria Szandrach. Maria is an experienced entrepreneur with over 10 years of experience and an MSc degree from London Business School. She co-founded Mentalyc as her third startup. You are my kind of human. The previous ones were problem solving in the mental health and insurance industries. As a teenager, and Maria, I appreciate you sharing this, Maria went to therapy for an eating disorder. She switched therapists 5 times before she eventually recovered. She devoted her career to making therapy more effective and efficient. Who could argue with that? Nowadays, Maria spends most of her days talking to clinicians, other entrepreneurs, and decision makers in various mental health organizations. As an ex-patient, she deeply values therapeutic relationships and therapy as such. She aims at making clinical work more rewarding and less stressful, the connection between clients and clinicians less disturbed, and the intuitively applied interventions recognized for their therapeutic impact. Again, who wouldn't want that? Maria, welcome and thank you for joining us today.
Thank you so much for having me, Margot, and for this amazing introduction.
Well, it's just you. So go you. You have been doing a lot using your own personal experience, using that experience for good to try to change something in an important way in the world. And you're a serial entrepreneur, which is amazing. You get something moving, it's solving a problem, you see another problem, and you head out after that. I love that. And all to try to make something in the world a better thing. So that's wonderful. So, can you tell us, just to start with, about Mentalyc and the clinical problem this particular venture was designed to solve?
Of course. So I actually initially wanted to solve maybe more of my own problem when I started exploring the mental health space. So I basically looked back at my experiences with those five therapists. And I was wondering which of them had what contribution to my recovery and what exactly did they do that helped. I'm very sure that actually all of them helped in some way. But it was very hard for me to even understand how the process works and what were really the pieces. And I understood over time that it's also not necessarily always very clear for the clinicians. That they also get surprised sometimes if they meet a client later who says like, "Oh, this one thing you said," and they're like, "Oh, really? Did I said that? I thought it was something else."
The thing that had impact out of all the things we talked about. Right. That's something. Yeah.
So I was very fascinated by this at the time, and I was wondering if there is any way to get some more clarity, or maybe I've noticed that other fields or physicians have all of those complex tools to diagnose and scan the brain, and clinicians have very different tools. So that's how it started. But then when I met my co-founder and we were interviewing a lot of clinicians and trying to understand how their work and life is, also other aspects that what I've seen from the patient side, being with them in the room, we actually understood that the note taking was such a huge problem 5 years ago when we started Mentalyc. Back then, there were no actually any AI note takers or AI scribes for therapists. There were some early, let's say, some companies trying to do this for physicians. So it was this transition period from physical scribes following the doctor through the hospital to, for example, people offshore transcribing and maybe some first AI moves in that direction. But everyone was telling us that the room of the therapy room, there's no way there will be any scribe. No one can listen to this.
Nope.
And what clinicians would really love to have their notes problem gone. And we were wondering, really, is there something that we can do about this? It wasn't very clear that it's even like technologically possible. So we started looking into the AI that was back then like very, let's say, niche compared to now. And we started sort of like developing this idea that maybe if we could actually somehow help with this and like process the data in session in some way to write those notes, maybe we can also help clinicians eventually to maybe spot some patterns they missed or like bring something to their awareness. It seemed like they were all very excited about this, but we didn't know if it can work. So we spent actually the first year of the company like experimenting, trying to create something. Our first products were, I guess, like quite horrible. They were just like picking some keywords, looking for sentiment of the conversation. But eventually we started writing like very simple progress notes. And first we did it on like basically like made up therapy sessions because we didn't have full HIPAA compliance and security. But then the clinicians told us like, oh, this actually like I could use this. So
Mhm.
then we spent another eternity to make the product very secure and make sure that it actually could handle the very intimate conversations in therapy. And we actually started saying that the clinicians were really very hungry for a tool that just takes those notes.
Absolutely. Absolutely.
So we actually started developing the tool from there. We first created all of those different templates for progress notes, so Soaped Up and many others. And then we expanded to other like client types, so couple therapy, family, group, children, different modalities. So we have like EMDR, brain spotting, let's say positive, negative cognition are very unique to this modality to be documented. Then like play therapy, because we noticed that AI can write very funny notes with from sessions of children, like for example, intervention to find a Pokemon. So,
Right? Yep, I've
so
heard
we
that.
had to teach it to interpret sessions of children. Then we added also intake notes, treatment plans, then we connected it all together so that the AI has this like context and continuity. It can track certain goals, let's say, throughout the progress notes all the way till discharge. And then we added even a couple more tools that actually moved us a bit more forward towards this, like trying to understand therapy. So we've added progress tracking. So we extract, currently it's only actually very like, I don't know, CBT or medical
Mm,
model way of tracking progress, which we also want to expand more on. So far, we can only measure how the symptoms are changing. So
mm,
frequency, intensity of particular symptoms that are relevant for this particular case.
mhm.
Mm, we are still exploring how otherwise we can track progress reliably. So if your listeners, Margot, have any ideas, I would love to
I'd
hear
be
those.
happy to. I'd
Because
be.
it's quite difficult to actually figure out how to measure something that is not linear and just so confusing in general.
Mhm, mhm,
So that's that. And we also have a feature that we call Alliance Genie, which helps with therapeutic alliance as such. So it's a sort of like a model that is tracking different aspects of the relationship. For example, how the rapport is built, what's like the pacing of the session, let's say if the like humor and like general like attunement and alignment is there.
Seriously, so it's not, I'm sorry to interrupt you, Miriam. So it's not just scribing the note and then AI doing its magic and putting it into a nice format that insurance companies will like. That is impressive and stunning that the tool is able to assess how is that rapport building going? How is it doing that? I mean, it's a complex system, but what is it listening for and how does it give that feedback to the clinician? That's incredible. I haven't heard that from anybody else.
So we took inspiration from a lot of different existing clinical tools. So there are like standard inventory of therapeutic alliance and other questionnaires, we could say, that are usually sent to the clients.
Hmm.
Plus, there are some other frameworks that are maybe helping with supervision when, let's say, there's this third person view discussing what happened, right? And we basically picked up a lot of common points and what matters for the alliance. We of course worked with a lot of supervisors and we have tens of thousands of clinicians using our tools, so we talk a lot with them. And we basically wanted to create something that would be like as if you had a supervisor always with you, kind of in a session. So
Wow. I love that. I've been a therapist for 35 years and I still would love that. I think that's incredible. We can all use that kind of feedback.
we exactly noticed that like it's never somehow, no one is too experienced to find something new.
Exactly. Exactly. That's it. Right. And I'll tell you, I've had some clinicians, often they're a little bit younger. They'll say, I'm finished, I'm licensed, I don't need supervision anymore. I don't need to talk to anybody about cases. Yes, you do. Of course, we all do. This is a really personal kind of experience, and our human subjectivity can cloud everything, and that's not hyperbole. It just can. So that's incredible. What kind of feedback are you getting about that tool?
So actually, all sorts of like indeed, I also noticed really that the young clinicians are usually a bit more self-confident.
I don't know what you don't know yet. Right, exactly. That is a thing. I
Exactly.
forget what that phenomenon is called, but the less you know, the more confident you are. And the more confident you become, the
Yes,
more you
there's a
don't
name.
know.
It also escapes me, yes, but this is like a known indeed phenomenon. We see definitely with clinicians that usually there's initially this like fear before seeing the first client that this confidence goes steeply up.
Yep,
And
that's
there's a
right.
crisis.
Uh-huh. Yeah, that's one thing about being, and you don't know things. So anyway, with
But
all
it's the case for everyone, right? And not just clinicians. I also learn all the time. I always feel like I just know so little about everything.
right, it is
So
a phenomenon. Yeah.
So yeah, it depends exactly on the, let's say, person, like their stage in life, let's say maybe like the openness to feedback, to experience, and people have different goals. So we have some clinicians who say like, oh, I don't want this AI telling me what I'm doing wrong. And we also have clinicians who are very, very happy and very grateful and give us more ideas what we should add there. Now we're actually discussing adding like different sort of like, let's say, personalities to this supervisor. So the feedback can be, let's say, like harsher for those who like it, or like, the different, let's say, tones or demands from the clinician.
Fascinating. That's incredible. So it could be if you want more blunt, direct feedback, you can request that. If you need something a little softer because it can be injurious to the clinician, or they want something that's just a little more gentle, they can request that. That's fascinating. So an internal supervisor, built-in supervisory function. And so is that just about rapport building, or is that available throughout the course of the?
No, so this one is like the whole, maybe like between 25 and 30 different aspects of alliance. So there's a cultural competency, also like how often are the goals discussed, like how much are we sort of trying to get to the treatment goal agreed with client, and all sorts of really things. We even have some customizations for like family and couple therapy. But yes, the main product as we started was the note taker. That's what we were for the first, let's say, 3 years out of 5. But we always had this passion for like trying to help clinicians actually be like better. So not only more efficient, but also more effective and more confident in what they do and happy with themselves, but also still growing.
Mhm.
So we've also noticed there is a big isolation between clinicians. So they, let's say, feel a bit lonely and burdened by all of the trauma. So we wanted to sort of like, because also not everyone has access to a supervisor at all times, right? They're expensive, also hard to find the one that matches you, I guess, same as with clinicians for patients. So we thought that I wouldn't say that it's like a replacement of a supervisor, but it's like a helpful tool that you can also use to, for example, like discuss with the supervisor what it said, or if you don't have access to one, then it's, I guess, better than nothing.
And to your point, if it's used as a tool, and I know therapists get concerned that, and your company does not do this, you're not teaching the system how to replace therapists. That's not what you're doing. It's not being used to learn that and then apply it. I don't know if you saw the Wall Street Journal this morning. I think NVIDIA is really investing heavily in some of these online tools that are maybe not intended to replace physicians, but might be able to go and talk to a bot instead of having to go into an appointment. And therapists are concerned about that. Two.
And like understandably, yes, yes, that's also we basically believe that we need to give clinicians the tools so that actually this doesn't happen. So it's not like a clinician versus AI, but it's a clinician with like all of the potential of AI, but still the human presence and the alliance that only humans can achieve.
Mhm. Which I think folks will be relieved to hear that's not the goal, and you don't sell the data and you don't store the data and you're not training other models to. So that folks from where I sit, because I did do a little research on that before we spoke, that this is not hyperbole, every time I have a conversation with a group of clinicians about AI, there is somebody in the group who is concerned about training to replace us and but even the supervisory function, to your point, boy, you could take this to a supervisor and have a conversation because it's not just here's the feedback, but it's now how do I adjust this? What might this be about for me that I'm missing this, that I can't attune to this, that I can't be a part of this, that I can't pick up on this? What is it that's happening? So, that human element as a therapist, we know that human element is exceptionally important for change. It's brains need other brains. There's the ways that we will attach and attune, and that no system, no program, no tool can replace that, folks. So, this is how do we make our work easier, not how do we replace us. So, I think this is fabulous and having that kind of feedback because the supervisor will not have been in session. And I remember when we had to record our sessions, and some clients were okay with that and many weren't. So if we couldn't record those sessions, then we never really got feedback except what I reported, which is still going to be subjective. So I love that function. So, when I've gone to my physician's office, my PCP, they will say, we now have the system, it'll take notes. Are you okay with that? Yes, that's fine. And so, are you finding that clinicians are seeing that this isn't an intrusive factor in a session? How does this work? Let me ask you that, just not mechanically, but functionally, how does this work? I will never get the mechanics. But if I'm in person with someone, how would it work? Or is this only for virtual sessions? And how does that work?
It works for both setups. So if you are in person, then you can record the sessions. So there are two ways. Either you can record the session or you can dictate a description of the session as a clinician if someone doesn't want to record. But if the patient, the client, depending how you like to call them, is okay with recording, then we can record in person on a phone. So the app is available both on desktop and on phone. And for the telehealth sessions, it can also record directly. It connects to wherever the session is held. It's for more technical listeners, a Chrome plugin. So if a session is held on any web app, so it could be in the EHR or Google Meets or Zoom or any other tool, it connects directly and this way basically collects the audio. And then we transcribe the audio. We delete the audio file, so we don't have the actual recording of the session anymore. And we also anonymize the transcription. So we remove all the PHI, so personal health information, and that includes like names, but also insurance numbers, addresses, phones, all of the locations and other things. So the transcript is really something you could also bring to a supervisor, for example, for discussion or another person that does not officially has access to the records. And from this, we write the notes. So there are then several different models that are specialized in different activities. So they will either look for those symptoms and collect them, look for impairments, and try to justify diagnosis, and look for whether there's medical necessity and how can we best describe it so that the insurance element is covered.
Mhm.
And then they look for all sorts of things. We have actually also a lot of, we call them biosocial markers. So psychosocial markers, we call.
Uh-huh. Okay.
So we have things like, for example, I don't know, sleep, like substances taken, all sorts of things tracked throughout the time, also risk, whether there are safety plans and so on. A lot of those things can be also turned on and off. So let's say a client doesn't have any risk, maybe we don't need this. And that's how the note is created. And clinicians have full control over what is stored. So they can, for example, say they don't want the transcript and just the note. or they have this anonymized transcript. We also have an option to have partially anonymized transcript, which is specifically useful for group therapy, for example, or family. When you want to know the names, the first names of people to not confuse them later in the story.
Mhm.
Then we allow keeping first names and high-level location without details. The whole system is fully HIPAA compliant, so there is no legal reason to not have the client names. But because we know that it's such a sensitive material after all, right, we allow those different levels of anonymization.
So ultimately, if I'm seeing a client in person, I would have my phone and I would put it maybe on the coffee table and it would be picking up the audio.
Mhm.
And then if we're on, right now we're recording on Zoom. If you're on Zoom, I'd hit the record button or whatever. It can integrate with this, and then it would record the audio and it would digest and metabolize and produce a note, a treatment plan based on the information that was presented, but it'll strip out any private health information that we don't want it to have. And we can customize it so that if the person's a non-smoker, we're not doing a smoking assessment every week or every month or whatever. So it's customizable in that way. Okay. This confidentiality piece, I don't have to tell you that you do this every day, all day. It is the thing people are worried about. I can't tell you how many times, again, I've talked to clinicians. I have 82 that practice, and they'll say, some folks will say, that sounds great. I don't have to worry about my notes anymore. And others will say, as we've talked about, they're going to train other systems so that we're out of work. And others will say, how do we know it's really confidential? They say they are erasing it, but maybe they're really not. To which I kind of think, why would anybody want to keep that? They don't care what so and so, Mary Smith did 2 weeks ago with her pets, whatever it is. So I don't see why that information would be stored, but you're saying, yep, that is not a thing. We do away with that. It's stripped out.
Yes, so it's all valid concerns. I totally understand them, but I think we are actually, and companies like us maybe, are not necessarily the biggest danger here. I would say the biggest danger would be clients talking to the AIs, because this happens actually a lot nowadays, right? Everyone is talking to like GPT or something, and it's definitely not like it helps some people. So, like if it's a smaller thing, you need to like bounce off with someone. Like I hear it's helpful for some people. But definitely with like more complicated trauma cases, it could be more harmful. But nevertheless, people do it. And when people do it and talk to, let's say, GPT, which actually trains on these conversations, that's where it learns how to talk to people, right? And it's probably not gonna learn how to be like clinically helpful. It's gonna learn how to satisfy the person so they pay and keep subscribing to GPT. So there's that. Companies like us, we actually, like our client is the clinician, right? So even if you try to follow like the logic, why would we replace our own client?
Exactly. There you go. I love that. And people do use ChatGPT. It's the number one use of ChatGPT is for therapy. I mean, it's not therapy, it's for advice or for some kind of dialogue or support. And to your point, they're going to tell you how wonderful you are. What a great job you did at whatever it was, because that's kind of the goal for them. Keeps them hooked, right? So it's a great point, Maria, that you're not trying to replace your own customers, right? And really, there are other tools that are doing that we should be more concerned about. I think that's a really fair point.
And it's the same risk for anyone, really, right? And to some degree, it's unavoidable. The AI learns from people talking to it, right? So even if I am talking to my AI about how to, I don't know, improve my marketing campaign or something in business, from this interaction and AI trying to help me solve it, it will learn how to do that, right? And also, there are all of those copilots for developers. I see that the engineers on our team also use a lot of AI. I guess everyone does nowadays. And that also learns from them solving problems. So I think we all will be to some degree replaced. Maybe not us replaced, but some things we all do will be replaced to a degree. So I think for clinicians, it's just important to like really be kind of owning this relationship and sort of like driving this clinical process. Like I see also clinicians even work together with AI on like between sessions activities that, for example, they brainstorm with AI, how to, what did I hear recently? I was talking to a clinician who was seeing children and was looking for like cartoon snippets that are well kind of fitting the child problem. So they were looking like, okay, this child really likes this cartoon and keeps talking about it. So maybe there's an episode that shows how like the character resolved some sort of problem that the child is facing. So I think that's actually brilliant as long as the clinician is actually like, making those choices, right? And that's also what we want to support. So clinician has more tools, but those problems are also not new to find like the right exercise and the right material for the client and have it like super tailored.
Mhm.
So AI can definitely help with a lot of those things. And I think it's better if exactly clinician is basically deciding and evaluating all of those ideas that AI has,
Mhm.
rather than people going straight to AI without understanding of like all of the clinical aspects of it.
Yeah, exactly. I think that's well said. So, what would you say is the number one, number two, number three takeaway? What would you like people to understand about Metallic, about why this is a tool that might be really helpful for them as clinicians, and how it actually helps their clients in the end as well?
So if maybe let me start like in general with the AI and note takers, whether it's us or any other tool, I think it helps clinicians to basically spend more time on what really matters. So on being present, not distracted trying to like scribe something down, or tired after spending evenings and weekends trying to catch up with the notes and then getting bitter about the job. So that's definitely the benefits of just using the note taker. Client definitely benefits as well because they also have this more present and rested clinician who is happy with what they're doing.
Mhm.
And depending on more modalities and perspectives, but clinician usually has a bit of this role of replacing this attachment figure, right? Like the maybe parents or some other attachment figures from before. So we don't want to kind of repeat what the problem was with the parents, that they were, let's say, absent or busy or tired and they were annoyed with this kid.
Mhm.
So if we can be like more present, have more of the positive regard and so on, I think that's definitely better for both sides. And now when it comes to maybe Mentalyc specifically, I think we are the only tool that really kind of went so much beyond the nodes and has all of those extra perspectives and tools for growth. So we might be maybe like let's say a bit too much for someone who doesn't care and wants just like quick progress note and gone.
Which sounds so
But
sad. Right?
for those who
Reality.
want to have like really excellent notes and also learn something more about what they're doing and accept the kind of changes that come with everyone using I think Mentalyc would be a good choice.
That sounds wonderful. So, if someone wants to learn more about Mentalic and really dig in a little bit or maybe demo the product, what's the best way for them to make that happen?
So we have a website, which is the domain is called mentalyc.com, and that's a good start. So you can start a free trial there, which is 14 days, and you can try all the notes and just see if you like it. We have a lot of videos, tutorials already inside the app, so it's very easy to do it on one's own. But we also have a customer support service, which is also very easily findable from the app. So we have a little chat bubble in the corner.
Okay.
So you can always chat with us and also jump on calls. We're also happy to show things around. We also run a lot of, in the startup world, it's called user research. So we have an anthropologist talking to clinicians every week, trying to understand how we can improve the product. So if someone has exactly ideas and wants to contribute to what frameworks we use and so on, we're also very happy and our doors are always open for that.
Mm, that's wonderful. And right, because you're growing, you're teaching and training yourselves to make a better product, not to sell to make it some behemoth out in the world. So you want to improve. It's constantly you're wanting to improve the product over and over and over again.
We keep learning about therapy and clinicians every day. So there's always, as I said, so much to learn, I guess, for everyone and definitely for us.
Mhm.
So we want to make it most helpful. And it's also basically like really kind of my passion project, other than also being a full-time job.
Uh-huh.
I really love the topic and I always wanted to make therapy basically better in any way possible.
I love that. And you can speak to that. And again, folks, I think this is important. Maria is someone who changed therapists 5 times. And we don't want to be one of those therapists who didn't provide what you needed because there was something that we missed. And maybe a conversation for another time would be, how do people catch that sort of thing? But that's a conversation for another time. Well, Maria Szandrach, thank you so, so much for coming and sharing about Mentalyc. I haven't done a whole lot of podcasts about products, but I think AI is really big right now. Obviously, Captain Obvious, it is huge in our field. People are afraid. And I think because you develop this, like you said, as a passion project, you're not just an investor. You're not just somebody who has come along and thought, well, this looks like a great lane. You're somebody who has experienced the need for therapists to really understand what they're doing as best as they can. And yay, if we can do a better note and a better treatment plan and get things done more quickly. So I love that it's the whole package. So folks, check out Mentalyc. Just go to mentalyc.com. We'll have all the information in the show notes. Maria, thank you so much for joining us. All of you, thank you for listening. I'll look forward to having you with me next time. Be well.